Have you heard about respiratory syncytial virus, also known as RSV? If not, don't worry, we're here to break it down for you. RSV is a common respiratory virus that often mirrors the symptoms of a mild cold. It's something most of us have probably encountered at some point in our lives without even realizing it. But don't let that fool you. While it's generally mild for most people, RSV can be more serious for certain groups. In particular, infants and older adults are more susceptible to the virus and can experience severe symptoms. It's also the most common cause of bronchiolitis and pneumonia in children under 1 year of age in the United States. So, while it may sound like just another cold, RSV is something we all need to be aware of. So now that you know what RSV is, you might be wondering, what are the symptoms to look out for? The symptoms of RSV might surprise you. They often mimic those of a common cold, making it difficult to distinguish between the two. A child with RSV may experience a runny nose, a decrease in appetite, and bouts of coughing and sneezing. A fever can also be present, and in more severe cases, wheezing might be heard. Now you might be wondering, how does one get RSV? The virus spreads through respiratory droplets, often when an infected person coughs or sneezes. Those droplets can land on surfaces where the virus can survive for several hours. Touching these surfaces and then touching your face can lead to infection. Close contact with an infected person, such as kissing the face of a child with RSV, is another common way the virus spreads. Knowing the symptoms and causes is crucial, but how do we go about diagnosing RSV? Diagnosing RSV isn't as difficult as you might think. The process starts with a basic physical examination. Here, a healthcare professional will listen to the child's lungs, check their breathing, and assess their overall health condition. Next, they'll delve into the child's medical history. This step is crucial as it provides insight into any pre-existing conditions or risk factors that might make the child more susceptible to severe RSV infection. Finally, laboratory tests may be conducted. This could be a nasal swab or a blood test. These tests are designed to detect the virus, confirming the RSV diagnosis. Remember, early diagnosis is paramount. RSV can lead to severe complications, especially in infants and young children. The sooner we identify it, the better we can manage it, and the less likely it is to become a serious threat. Once we have a diagnosis, what steps can we take for treatment? Treatment for RSV primarily involves managing symptoms. It's a bit like dealing with a common cold. There's no specific cure, but there are ways to alleviate discomfort and promote recovery. A common approach is using over-the-counter medications to manage fever and pain. And let's not forget the age-old remedy of hydration and rest. The body, in most cases, is perfectly capable of fighting off the virus on its own. It just needs a little support, a little TLC. But remember, while this might be the general rule, it isn't always the case. Severe symptoms should never be ignored. Difficulty breathing, dehydration, or persistent high fever are alarm bells that warrant immediate medical attention. Although RSV might seem daunting, understanding what it is, its symptoms, causes, how it's diagnosed, and its treatment methods can equip us to handle it effectively. Knowledge is power, and in this case, it's our best defense against RSV.